Hello and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. I'm your host, Jason Howland, and today we're talking about knee pain. In particular, knee pain in women. Almost 1 in 3 Americans over the age of 45 has experienced some kind of knee pain. And joining us is Dr. Lael Luedtke. She is a board-certified orthopedic surgeon at Fairmont Medical Center, part of Mayo Health System. Thanks for joining us today on Speaking of Health.
Well, I'm happy to be here. Thanks for inviting me.
Well, today we are talking about knee pain in women. First of all, let's start with the basics. How exactly is the knee made up?
Well, the knee is the largest joint in the body, and thus it's very prone to injury and wear and tear, arthritis, and problems. And as most people know, it's the connection between the femur or the thigh bone and the tibia or the shin bone. Now, there is a compartment of the knee joint that tends to get overlooked often and is particularly important in women, and that's the interaction between the kneecap and the underlying thigh bone, and that part of the joint is called the patellofemoral plane. Of course, the knee joint has some shock-absorbing cartilage that separates the two bones. These are called the menisci. And of course, most people have heard or had some injury to the menisci or a tear of the cartilage. Then, of course, the knee is also connected by assorted muscles and tendons, as well as ligaments. There are 4 main ligaments that are of importance in the knee. There are 2 crossed ligaments in the center of the knee, and then one on the inside and one on the outside.
And that's when you hear about injuries, ACL injuries, and some of those.
Exactly.
Those are those ligaments, right?
Those are those crossed ligaments. The ACL in particular is a very commonly injured ligament, and especially so in women. There's also a PCL, and that can get injured as well. But that's more commonly an injury that occurs in a car accident or some other major impact.
And you talked about the menisci. What exactly are those?
Well, the menisci are like 2 donuts, donut-shaped structures, one on the inside of the knee and one on the outside of the knee. And they help to deepen the joint so it makes it a bit more stable. And they also serve to absorb shock and broaden the area of contact between the 2 bones. And we've unfortunately learned the hard way that those menisci are extremely important in the health of the joint. Back in the 60s and 70s, they were thought to be just remnants of development. And so if they were torn, the entire meniscus was removed. Those people are now almost universally requiring knee replacement surgery now because of the loss of that shock absorption and the contact pressure.
Because if you don't have those, it's bone on bone? Basically?
Essentially, exactly.
So it's like not having shocks on your car. It's going to be a rough ride.
It is not going to be happy. You're going to need to do something eventually.
So our topic is women and knee pain. Are women more susceptible to knee pain? And if so, why?
They are. And I think that it's a bit underappreciated that it does affect disproportionately women over men. Part of it is an anatomical or just structural issue. We have wider pelvises, mostly to accommodate childbirth, but it does create some consequences then for the alignment of the lower extremities as one goes from the hips down to the floor. And this change in alignment results in especially the issues with the patellofemoral joint. And so there's the structural reasons for having more knee problems, but there are also some issues that we don't understand very well, including some issues relating to growth factors and how women repair injuries within our bodies versus how men do, and it's a bit different. There's a very distinct difference in the pattern of development of osteoarthritis, the wear and tear arthritis that is very common in people.
Well, you talked about the knee being the largest joint in the body, and it is used a lot, whether you're walking, you're running,
Exactly.
Even sitting down, you're bending your knees, you're moving your knees all the time. So can overuse of the knee, can that sometimes lead to knee pain in women?
It can. Overuse injuries tend to be a bit shorter in duration and less severe and ongoing than some of the longer term problems. But for example, there are a number of structures around the knee that are kind of prone to getting inflamed and irritated with doing activities that either are very occasional or just really overusing or repetitive type injuries. And so, for example, there's a bursa or a small fluid-filled sac that's on the front of the knee, and that can very easily become irritated with kneeling, or especially if you're doing something like gardening or working on a floor. But some tendons can also get irritated and create pain. And the pain can be significant, but fortunately it tends to be fairly short-lived.
And overuse, it doesn't have to be super strenuous activity, heavy sports activity or anything like that. It can be just simply being out gardening and out there on your knees for a long period of time, right?
Exactly. Activities, and especially as we get older, unless we do an activity fairly commonly, to go back and suddenly do it with something that you haven't done in a long time, the harder it is to recover from doing that activity, and that can create some inflammation and pain.
If someone's having knee pain, when should they go see their doctor?
Well, it depends a lot on the pattern of pain. Unfortunately, life is not a painless condition, and so all of us, especially as we get older, tend to have more aches and pains. So if the pattern of pain is something that it's occasional, it's not particularly worsening over time, it kind of flares up but then flares down, that kind of pain can be pretty easily managed with some simple things. Ice, elevation, rest, those sorts of things. It's when pain becomes more persistent, it becomes worse with time, and really starts to affect activities of daily living. That's when you should start to consider seeing a physician, either a primary care physician or an orthopedic surgeon, about those pains.
Are there certain physical or medical conditions that can lead to knee pain?
Well, there are. In women in particular, there are some conditions that are greatly more common than in men. For example, we talked about the ACL, the anterior cruciate ligament. And that type of injury, I think most people associate with high-level male athletes. Unfortunately, it's actually greatly more common in women than in men. And there's some anatomic reasons for that and some things, again, we probably don't fully understand, but that's an issue that is a huge problem for women, especially active women. We also see more autoimmune problems in women. So conditions that are systemic, affecting everything in the body, but especially the joints, such as rheumatoid arthritis or lupus. And those have a disproportionate presence in the female population than in the male.
Is there a reason for that?
Not that we really understand why that is so much more of an issue for women, but there's unquestionably a real gender difference in those types of conditions. We also see issues related to the kneecap, as we've already talked a little bit about, that affect women, and that can start affecting women in their teens and can be quite persistent through their lifetime. And there are some things that can be done about it. We also see that osteoarthritis, the very common wear and tear type arthritis that happens to a lot of people as they age, is also much more common in women.
All right, so a woman is experiencing knee pain. Let's start with the basic treatments. Minor knee pain at home, what can they do? And then the more serious treatments if they're having more serious pain.
Well, of course, there are the basic things we talked a little bit about with the rest, ice, compression, and elevation, what's known as the RICE protocol. And in addition to that, women should also be looking at their activity level. Being inactive is one of the most damaging things to human health. And so while women and in people in general, the inclination is that if something hurts you, stop activity. Actually, more than likely, unless it's a very unusual circumstance, increasing activity is usually helpful for diminishing pain. So I would encourage people to be active, especially for women. Strengthening is particularly important. Now, if the pain starts to really have an impact in terms of activities of daily living, getting up from a chair, going up and down stairs, activities that we really take for granted, then that's a time to start looking at seeking professional help for that knee pain. I use physical therapy extensively as kind of the first line of defense in some of those circumstances, because inactivity leads to so much of our difficulty with our joints. If therapy alone is not successful in addressing it, then there are some injections of some compounds that we can do that can help with knee pain, especially if the underlying issue is wear and tear arthritis. Ultimately, however, if none of those treatments are effective, then we're looking at a knee replacement surgery if, again, the underlying issue is wear and tear arthritis.
And how does a knee replacement surgery work? What are the options for the surgery, and how long a recovery and that kind of thing?
The basic process of the surgery is removing the ends of the bones that have worn out, and typically our bones, when our joints are healthy, are covered with a thick layer of very spongy articular cartilage. And unfortunately, that cartilage is present when we're born, and it has a very low metabolic rate and a very poor ability to heal itself. So if there's been an injury that injures the cartilage, we aren't very good at replacing that or fixing that ourselves within our body. So gradually that cartilage wears away down to just bone on bone, and the bone gets very hard. It's a process called eburnation, and the surface of the bone is almost like a marble. It's so hard. And so we cut those surfaces off, and in knee replacement surgery, most typically use a bone cement to connect the prostheses or the bone implants or knee implants to the thigh bone or the femur, and then a surface is cemented down onto the tibia. In between those two surfaces, most commonly a spacer that is made out of a high molecular weight polypropylene or polyethylene. And then that acts as the shock absorber between the two metal pieces above and below.
And does it help patients once they've had the surgery? Is it like a totally different knee?
It's a dramatic improvement in activities of daily living and just generalized comfort. And it's it's actually one of the most cost-effective treatments in medicine in replacing either the knee or the hip. And it's really effective at getting people back to doing activities they used to do. And unfortunately, one of the dynamics we see in women in particular is that we tend to put things off longer than men. As a general rule, women, when they first present with knee pain, are at a much further extent of their wear and tear than men are. The process of getting a new knee is actually pretty straightforward. Usually a hospital stay of 4 to 5 days as a general rule. And then there's a lot of therapy afterwards.
Well, unfortunately, we're all out of time, but a great topic, women and knee pain. Thank you for joining us today on Speaking of Health, Dr. Lael Luedtke.
Well, thank you very much for having me.
And the phone number to schedule an appointment with orthopedic surgeon Dr. Lael Luedtke at Fairmont Medical Center is 507-238-8595. Have a great day, everyone, and be healthy.